short questions. Do you see this type of effect that you've been showing in the visual domain as well?
A really good question, because we've been wanting to create a visual task, and we're working on trying to create something, because of course creating a non-verbal task will be important. It will also be easier to compare across different languages. So that is something that we're doing at the moment.
Cool, thank you.
You're welcome.
Sathapang?
Thank you. Nice to meet you, and thank you for the very interesting present. I agree with Dr. Sirawat and you that the learning abilities in elderly is super interesting, because we did not measure this domain a lot in clinical practice. I have some questions to discuss with you in the experiment 1 and 2 that you have shown. I found that it's kind of interesting that we find that the subject has forgot after we do the non-repeated task, but you show that lot of memories was the case in first day, right? Yeah, but yeah. When we see in repeated measure tasks at 1 week, the memory is still there. I mean, there are 7 days between the first and the second measurement, but there is no effect of decay in this task. And it's also super interesting when you shown the experiment too, that you have the subject has to be do the task in 5 minutes, 30 minutes, or kind like that. In theoretically, these kinds of subjects has do as same as the repeated task in experimented on, because they also has to remember and do the task at the 30 minutes. But the performance is very different. In repeated tasks, the performance is dropped significantly. So this finding reminds me of the interference theory, if I understand it correctly. Maybe the first 2 stories that we have to repeat it, remember it, interfere with other story, I don't know. Or maybe the 2 tasks that we have to repeat it, answer, interfere with other tasks. And maybe this can make an effect in the experiment. Have you ever account this interference effect, and what we will do with them?
Yes, I think it's an interesting question, because the first 2 stories were also the repeated ones, so it's difficult to tease apart whether it was because they were repeated or whether they caused interference to the subsequent stories. And because it was just this one patient and we didn't do it with, we couldn't do it again with him, we can't tease them apart. But I know that from my background in autobiographical memory, that recalling something has an impact of refreshing the memory trace, and then you lay down another memory trace. And through that, you end up with stronger and stronger memories. So each time you recall something, you wake it up and then you lay it down again, but you lay down a second version of it. And then the third time you recall it, you lay down a third version of it. And so in the memory literature, this was known as episodic memory, where repeatedly recalling an episodic memory creates a stronger and stronger trace. And this is how we create schemas of our knowledge of the world. So I think that it's the repeated recall that seems to be doing something, which is just activating the memory trace and then gluing it back together again and allowing that gluing to be stronger. So although interference might be an issue, I don't think it would be enough of an issue to have the impact that it did in this study.
Thank you.
Sorry, Ashok, I've got one question in chat, which is quite a quick one. And I can't see who it's from, but they ask, For the patient who had issues with his memory concerning his trip to Hawaii with his wife, was his memory from childhood or earlier adulthood affected too? Or was it only from a certain point?
That's a very good question, and it's something that we don't have a very good handle on, because whereas with patients like Nicola, we have a discrete point at which we know their brain disorder started because of her encephalitis. With these patients with epilepsy, we don't know when that epilepsy actually started unless it was a discrete episode. So with patients with this type of disorder, trying to look at retrograde memory, so memory for a long time ago, it's difficult to tell, but they don't tend to have severe episodic retrograde memory problems. And so he was able to recall things from his past quite well. So memory problems seem to kick in about 8 or so years before we started working with him. But he didn't say that the problem was for memories from all of his life. It was remembering new things that had happened. So that's why it's an anterograde memory problem.
Okay, can I ask a question too? All right, very nice talk, and it seems like we are listening to your talk in a very timely manner, because we are about to launch. Dr. Isewan is here, one of my colleagues. He's running a big prospective cohort of elderly people in our hospital. He has like 7,000 people who come back to the hospital once in a while. Right. And we're about to trying to find kind of tasks that trying to tackle exactly that you're going for, that MCI, to differentiate between MCI or SCI complaint from normal people. And it's always bothered me, like, what's the definition of subjective cognitive complaint? Because it depends on what kind of task that you were running, right? Because if you use one kind of task, you might not find, but if you push hard enough, I bet that you'll be able to find is preclinical, which I also don't know what does it mean, because it depends on, you know, what kind of task that you ask the subject to do, right? Because super demanding, you will eventually find something. I think your task seems pretty robust. And from medical perspective, I'm wearing a doctor hat right now, that you might want to also do sensitivity and specificity of the task, just not trying to see that they're different from each other, but also point out like the exact cut point that we will to use in clinical practice. And also the visual version, we also have one of the visual version that we kind of developed, but maybe we can talk about this afterward, after the talk or somewhere later, because it's going to be quite important, as you point out. So, but my real question about your talk is about the mechanism that I think you might find this interesting. Do you think that, so I'm pretty interested in this consolidation part of the rehearsal effect. And do you think that at one point, if people like rehearse up to a certain point, it will be some group of people who you can't interfere with that memory afterwards? Or maybe you can have another group of people that say the memory get consolidated better, or interference tolerance, which could be another marker of future dementia. What do you think about that?
I think that's a really interesting possibility. And just to tackle the first issue, I completely agree with you about the sensitivity issue. And this is why I started with the trip down memory lane, because the tests of memory that were developed for these patients with very clear amnesia. And so they were developed to identify them, but then those tests are being used for people with dementia, which is not amnesia. And so we're using a test that was developed for something else. And with the work that I'm doing with Graham, which I think you're involved with the executive functions, it's the same thing, that the executive functions tests don't have the sensitivity. So my attitude here has always been, just because you can't find it with the test that you've got, it might be that it doesn't exist, or maybe your test isn't good enough. So that's why we developed the test. In terms of your question, I think it's a really interesting one, that is it the case that we can consolidate anyone's memory such that it won't degrade, or is it the case that even if we got two groups of people and got them consolidated, there'll be one group that will be more susceptible to interference than another, and that group must have some sort of marker somewhere that is making them more susceptible. And of course, that's a lovely thought experiment. How we would run it, I don't know, but I'm always willing to create new research paradigms. So if you have ideas, then I'm very happy to create something with you.
You sounds fun. Thanks.
You're welcome. There's someone who's had their hand up for a while, and Deepa, sorry, I don't know.
Hi, so my name's Antipa, and thank you for the wonderful talk. Just a short, quick question. So as a clinician, I wonder, what would you predict the pattern of the test would be for patients with, we'll say, mild Alzheimer's or vascular dementia? Would it be different from healthy aging and epilepsy patients you have?
I would expect people who have already got a diagnosis of dementia to be performing even more, even worse than our slow elderly. So the way I'm seeing it is as a travelator, that we have the healthy elderly who are not going to develop a dementia. Then we have these people who are showing the rapid forgetting, but who are otherwise healthy. So we might call them an SCI group. And what I would ideally like to do is to get a clinical group that have got a diagnosis of SCI or MCI and compare them with my fast forgetting elderlies, and then follow them up a few years later, because if they've developed into a mild Alzheimer's, then we'd like to repeat them again. So I would say that what we would see is just a steeper forgetting curve with them, because the fast elderly that we're seeing, their forgetting curve, I think, is the direction of what dementia would show, until eventually there's no memory there whatsoever. Does that answer the question?
Would learning be worse as well?
Sorry?
Would the learning or
yes, I think the learning would be much worse as well. And I think that this is where titrating a task such that it was within the limits for allowing someone to learn, because we have to teach them something before we can test their memory. And if their learning and memory abilities are already so compromised that they can't spend 15 minutes learning something, then we of course have to shrink the task appropriately. So I think that their ability to learn would be much, it would take them much longer. So they, on that graph of amount of time or number of trials, they'd be showing it take them much longer. So I think that we'd effectively see just a much more exaggerated version of everything with them.
Okay, we do try and sort of keep the time on this. So it is a little bit past 9 o'clock now, Bangkok time. So I guess we should finish the meeting, because people have got things to do and got lives. And Ashok, I'm sure, is busy as well. But
I'm happy to stay on and answer questions if anyone wants to stay, but if it's better to close it formally, I'm also happy to move on.
Yeah. Well, what do you think, Kaipat?
I'm happy to go on.
Yeah. Okay.
Or maybe we can answer one last question from Dr. Chulalongkorn. Maybe he want to ask himself.
It's okay. You can read it. Sorry.
Okay. So we have another question from the audience. Say, in this task, you use 2 unrelated words. What if you use 2 pseudo words? Will it be more sensitive? What do you think?
Ooh, interesting. I think with pseudo words, there would be an issue, because some people would be quicker to learn pseudo words than real words. And I've just been giving a lecture about children's working memory, and children who can learn pseudo words and say them well better than children who don't. Well, children who have problems learning pseudo words or repeating them, they tend to have bigger problems with memory later on in life or acquiring language. So I think that if we showed people pseudo words, we would be bringing in an extra variable where I might be able to learn pseudo words easily because I travel a lot and I look at other languages, and I might see a pattern in a word that's a pseudo word to an English person might look like a Thai word or a Gujarati word to me, and so it's no longer pseudo to me. So I think it's not that I don't think it wouldn't be interesting. I think controlling it would be much more difficult. But I think it's an interesting idea.
Mm-hmm. I think maybe along the same line, I think it's quite similar to why we want to use visual or nonverbal, right? Because we want to get away from like educational effect or the effect of education.
And any previous knowledge. So people's knowledge of techniques, etc., for associating words can come into this more easily than if you show visual stimuli that they can't have rehearsed before or don't have experience of. So yeah, I think there are issues there.
Yeah.
We should add it to the list of collaborations.
Nice.
Is there any more questions? Is that it? I think people have had enough then.
Okay.
Yeah. Well, thank you very much, Ashok. That has been a very illuminating presentation. Very, very much appreciate you giving your time to us.
Thank you very much for taking the time, and apologies for the sound issues earlier.